The topic of the tutorial is Pterygopalatine fossa. I, Dr. Alpana Kesar, will be covering this topic under the following subheads. Contents of the pterygopalatine fossa. Maxillary nerve will be done in detail. Pterygopalatine ganglion. And third part of maxillary artery. Pterygopalatine fossa. This is the pterygopalatine fossa. This space is the pterygopalatine fossa. Here, this space is the pterygopalatine fossa. In this visual, this is the pterygopalatine fossa present between maxilla in front and the pterygoid process behind. The pterygopalatine fossa has three important contents. They are maxillary nerve, pterygopalatine ganglion, and third part of maxillary artery. Maxillary nerve. Maxillary nerve is an important content of the pterygopalatine fossa. It is a branch of trigeminal nerve. Trigeminal nerve has three branches or divisions, and they are ophthalmic, maxillary, and mandibular. Maxillary is a sensory branch of trigeminal nerve. It arises from the trigeminal ganglion. It runs forwards in the lateral wall of cavernous sinus. Maxillary nerve leaves the middle cranial fossa by passing through foramen rotundum. After passing through foramen rotundum, the maxillary nerve enters the pterygopalatine fossa. In the pterygopalatine fossa, maxillary nerve is present in close association with the pterygopalatine ganglion. In the pterygopalatine fossa, maxillary nerve gives four branches. 1. Ganglionic branches which it gives in association with pterygopalatine ganglion. Posterior superior alveolar nerve. Third is zygomatic nerve. And fourth is infraorbital nerve. Infraorbital nerve is a forward continuation of maxillary nerve. Ganglionic branches. There are 5 ganglionic branches that arise from maxillary nerve. Maxillary nerve gives these 5 branches in association with pterygopalatine ganglion. These 5 branches distribute fibers of 1. Maxillary nerve, 2. Postganglionic parasympathetic fibers of pterygopalatine ganglion. The 5 ganglionic branches are orbital nerve, palatine nerve, nasal nerve, pharyngeal nerve, and lacrimal nerve. Orbital nerve passes into the orbital cavity through the superior orbital fissure. In the orbital cavity, it supplies the periosteum of the orbit. There are 2 palatine nerves, greater palatine nerve and lesser palatine nerve. Greater palatine nerve passes through the greater palatine foramen and supplies hard palate and the lateral wall of nose. The lesser palatine nerve passes through the lesser palatine foramen and supplies soft palate and tonsil. This is the greater palatine nerve and this is the lesser palatine nerve. The nasal nerve passes into the nasal cavity. It supplies the nose through three branches. They are lateral posterior superior nasal, medial posterior superior nasal, and nasopalatine nerve. The lateral posterior superior nasal supplies the lateral wall of nose. Medial posterior superior nasal supplies the nasal septum, and the nasopalatine supplies the palate and the nose. The pharyngeal nerve supplies the nasopharynx, and lacrimal nerve supplies the lacrimal gland. The second branch of maxillary nerve is posterior superior alveolar nerve. Posterior superior alveolar nerve arises from the maxillary nerve in the pterygopalatine fossa. It enters the body of maxilla and then divides into branches that will supply the upper molar teeth, adjoining parts of the gums, and maxillary air sinus. The name itself suggests superior alveolar nerve which supplies the upper teeth, and posterior branch of superior alveolar nerve supplies the posterior teeth or the molars. The third branch of maxillary nerve is zygomatic nerve. Zygomatic nerve arises from the maxillary nerve in the pterygopalatine fossa. It enters the orbit by passing through inferior orbital fissure. After that, zygomatic nerve runs in the lateral wall of the orbit. The zygomatic nerve enters the zygomatic bone. In the zygomatic bone, the zygomatic nerve divides into its terminal branches, zygomaticotemporal and zygomaticofacial. Through zygomaticotemporal and zygomaticofacial, the zygomatic nerve supplies skin of face and temple. Zygomatic nerve gives a communicating branch to the lacrimal nerve. These fibers carry postganglionic parasympathetic fibers to the lacrimal gland. The fourth branch of maxillary nerve is infraorbital nerve. Infraorbital nerve is also called the forward continuation of maxillary nerve. When the maxillary nerve passes through the inferior orbital fissure, it enters the orbit, and then it is known as the infraorbital nerve. After passing through inferior orbital fissure, the infraorbital nerve traverses through infraorbital groove and canal. In the infraorbital canal, the infraorbital nerve gives two branches: middle superior alveolar nerve and anterior superior alveolar nerves. Through these two branches, the infraorbital nerve supplies the anterior upper teeth, that is, incisors, canines, and premolars. And it also supplies maxillary air sinus. Anterior superior alveolar nerve supplies incisors and canines, while middle superior alveolar nerve supplies premolars. The infraorbital nerve exits the infraorbital canal by passing through infraorbital foramen. Infraorbital foramen is present just below the infraorbital margin. The infraorbital nerve, after passing through infraorbital foramen, divides into its three terminal branches. They are nasal, palpebral, and superior labial. Nasal branch supplies the skin of the external nose. Palpebral branch supplies the skin of the lower eyelid. And superior labial supplies the skin of the upper lip and cheek. Posterior superior alveolar nerve block. Posterior superior alveolar nerve supplies the maxillary molars. So whenever a surgical procedure has to be performed on the maxillary molars, posterior superior alveolar nerve block is used. Posterior superior alveolar nerve enters maxilla on its posterior surface and supplies the molars. It is here at its entry that the anesthesia is placed for the nerve block. The needle is inserted in the buccal vestibule and is passed upwards and backwards till it reaches the posterior surface of maxilla, and then the anesthesia is deposited. This will anesthetize the upper three molars, which will enable the surgeon to perform painless surgeries on the upper molars. Infraorbital nerve block. Infraorbital nerve supplies the maxillary anteriors, that is incisors, canines, and premolars. Infraorbital nerve, when traversing through the infraorbital canal, gives two branches: anterior superior alveolar nerve and middle superior alveolar nerve. These two nerves supply the maxillary anteriors. The anterior superior alveolar nerve supplies the incisors and the canines. The middle superior alveolar nerve supplies the maxillary premolars. In infraorbital nerve block, the needle is inserted in the labial vestibule. The needle is directed upwards till it reaches the infraorbital foramen and infraorbital canal. Anesthesia is deposited in the infraorbital canal that will anesthetize the anterior superior alveolar and middle superior alveolar nerves. This will help to anesthetize the maxillary anteriors so that painless surgical procedures can be performed on them. Students, don't forget to like this video and subscribe to the channel to stay updated with the latest exam questions. Parasympathetic ganglion in head. There are four parasympathetic ganglion in the head region. They are otic ganglion, submandibular ganglion, pterygopalatine ganglion, and ciliary ganglion. Otic ganglion is present in the infratemporal fossa in association with auriculotemporal nerve, branch of mandibular nerve. Submandibular ganglion is present in the oral cavity in association with lingual nerve, branch of mandibular nerve. And pterygopalatine ganglion is present in the pterygopalatine fossa in association with maxillary nerve. In this chapter, we will do Pterygopalatine ganglion in detail. Pterygopalatine ganglion. Pterygopalatine ganglion is a parasympathetic ganglion. There are 4 parasympathetic ganglion in head region, and this is the largest of the 4. It is located in pterygopalatine fossa. Pterygopalatine ganglion is topographically related to maxillary nerve. Its fibers gets distributed through the branches of maxillary nerve. Functionally, it is related to the greater petrosal branch of facial nerve, as the preganglionic parasympathetic fibers relay into pterygopalatine ganglion, reach it through the branches of facial nerve. The branch of pterygopalatine ganglion are orbital nerve, palatine nerve, nasal nerve, pharyngeal nerve, and lacrimal nerve. These are actually branches of maxillary nerve, and the fibers from pterygopalatine ganglion get distributed via these branches of maxillary nerve. The postganglionic parasympathetic fibers from pterygopalatine ganglion are secretomotor to lacrimal gland, mucus glands in nose, paranasal air sinus, mucus glands of palate, and pharynx. The parasympathetic pathway of pterygopalatine ganglion. It begins in the superior salivatory nucleus and lacrimatory nucleus in the brainstem. The preganglionic fibers pass through the nervus intermedius and then the facial nerve. It then passes into the greater petrosal branch of facial nerve, which joins with the deep petrosal nerve to form the nerve of the pterygoid canal. The preganglionic parasympathetic fibers then relay into the pterygopalatine ganglion. The postganglionic fibers arising from pterygopalatine ganglion are distributed through 5 branches of maxillary nerve, and they are orbital nerve, palatine nerve, nasal nerve, pharyngeal nerve, and lacrimal nerve. And the postganglionic fibers are secretomotor to lacrimal gland, mucus glands of nose and paranasal air sinus, mucus glands of palate, and pharynx. Third part of maxillary artery. Third part of maxillary artery is yet another structure present in pterygopalatine fossa. Maxillary artery, which is present in the infratemporal fossa, passes through pterygomaxillary fissure into the pterygopalatine fossa. The part of maxillary artery which lies within the pterygopalatine fossa is called the third part of maxillary artery, or the pterygopalatine part of maxillary artery. The branches of this part are posterior superior alveolar nerve, which supplies upper molars, premolars, and maxillary sinus. Greater palatine artery, which supplies palate and tonsils. Infraorbital artery, which supplies orbital muscles, maxillary sinus, and maxillary incisors and canines. Pharyngeal artery, Pharyngeal artery supplies nose, pharynx and auditory tube. Artery of the pterygoid canal, which supplies auditory tube, pharynx and middle ear. Sphenopalatine artery, which supplies nose and paranasal air sinuses. Pterygopalatine fossa is an important exam topic for the dental students. The questions that may be asked in exams from the pterygopalatine fossa include a short note on pterygopalatine ganglion. Students may be asked to describe maxillary nerve under the following heads: formation, course, branches, and distribution. Yet another question that can be asked is to describe infraorbital nerve under the following heads: formation, course, branches, and distribution. Students should also be able to write the nerve supply of the maxillary teeth, including a note on maxillary teeth nerve block, which will include posterior superior alveolar nerve block and infraorbital nerve block.